Hello everyone. Today we are going to discuss about H5N1, that is bird flu. H5N1 bird flu is causing significant global concern due to widespread outbreaks in wild birds and poultry, as well as an increasing number of cases in mammals, including dairy cows. While the current public health risks to the general population remains low, health authorities are monitoring the virus closely for mutation that could lead to where efficient woman to woman transmission. Infection in people can cause severe respiratory issues like pneumonia, high fever, cough, and sore throat with a high mortality rate. Proper cooking of poultry and eggs renders the virus safe to consume. Symptoms of H5N1 in humans. Symptoms typically appear within 2 to 5 days of exposure and can escalate quickly. Respiratory with high fever, cough, sore throat, shortness of breath, and chest pain. Other symptoms like muscle aches, headache, fatigue, diarrhea, vomiting, and eye irritation and infection like conjunctivitis, red eyes, and severe cases can which lead to pneumonia, respiratory problem, altered mental state, or seizure. Risk groups are poultry workers, farmers, and veterinarian are at the high risk. It does not spread through properly cooked food. Treatment in human beings, that is antiviral drugs. Prompt treatment with antiviral drugs such as oseltamivir, Tamiflu, zanamivir, or peramivir in crucial. Ideally within 48 hours of symptoms onset and supportive care. Hospitalization of the patient often necessary for severe respiratory distress. Thank you. Take care.